A stroke can happen suddenly. A person can look completely fine one moment, and then, within minutes, their brain begins to lose oxygen. Every minute during a stroke, nearly 2 million brain cells can die. But here's what many people don't know. In many cases, the body sends warning signs first. In this video, you'll learn how to recognize a stroke early, before it's too late. A stroke happens when blood flow to part of the brain is interrupted. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. An ischemic stroke happens when a blood clot blocks an artery. A hemorrhagic stroke happens when a blood vessel bursts. In both cases, brain cells begin to die within minutes. The faster treatment begins, the more brain function can be saved. One of the most common early signs of a stroke is sudden numbness or weakness, especially on one side of the body. This usually affects the face, arm, or leg on just one side. This happens because a stroke damages the part of the brain that controls movement on the opposite side of the body. Another major warning sign is facial drooping. One side of the face may feel numb or look uneven. This occurs when the stroke affects the facial nerve pathways in the brain. If someone's smile looks uneven suddenly, treat it as an emergency. Sign number 3 is sudden trouble speaking or understanding speech. Speech may sound slurred, or the person may struggle to form simple sentences. This happens when areas of the brain responsible for language are affected. Sign number 4 is a sudden, severe headache. Some people describe it as the worst headache of their life. This type of headache is more common in hemorrhagic strokes, when a blood vessel bursts inside the brain. If a severe headache appears suddenly and intensely, seek emergency care immediately. Sign number 5 is sudden vision changes. You may experience blurred vision, double vision, or loss of vision in one eye. This happens when blood flow is reduced to the areas of the brain that process visual information. Any sudden vision change should be treated as a medical emergency. Sign number 6 is sudden dizziness, loss of balance, or difficulty walking. You may feel unsteady, like the room is spinning, or struggle to coordinate movements. This occurs when a stroke affects the cerebellum, the part of the brain that controls balance and coordination. To make stroke recognition easier, doctors use a simple method called FAST. F stands for face. If one side of the face droops or feels numb, this could be a stroke. A stands for arms. If one arm drifts down or feels weak, it may signal brain damage. S stands for speech, and T stands for time. If you suspect a stroke, act immediately. Call emergency services right away. Do not drive yourself to the hospital. Emergency teams can begin treatment immediately, even before reaching the hospital. If possible, note the exact time symptoms started. This information helps doctors decide the best treatment. Recognizing the signs early can save a life, maybe even the life of someone you love. If you remember one thing from this video, remember FAST. If you see these signs, call emergency services immediately. Do not wait. Awareness saves lives. Share this with everyone. It could help them sooner than they think.